In today's video, I would like to share with you some possible options that you can try to help overcome your anxiety or depression. In America, approximately 20% of the population is suffering from some type of mental illness. And as we all probably already know, it isn't a one-size-fits-all treatment regimen that is going to help these patients. Years ago, a physician reached out to us regarding a patient that was struggling with tapering off of her antidepressant. We were able to compound this medication and reduce the dose by 1 milligram every 2 weeks. Now, of course, it took the patient a good 9 months, I would say, to completely taper off of her medication. But she was able to do so without suffering the unfortunate withdrawal symptoms this antidepressant typically has. So that was a huge win for this particular patient. Very often, medications are first-line therapy. Unfortunately, with a lot of the antidepressant medication especially, these medications can take weeks to months for them to show benefit. And unfortunately, a lot of times they also come with a lot of side effects that outweigh those benefits. So these patients are left struggling, trying to find the right medication for them. To completely understand how to treat anxiety and depression, it is very important to work with your provider on trying to identify the root cause of your particular issue. I encourage you to seek help, professional medical help, in trying to, again, uncover that root cause of your anxiety and or depression. It is important that patients change their eating habits to improve their eating habits. It's important to exercise, of course, and it's also important to reduce stress as much as possible. Here are 4 basic nutritional supplements that I recommend considering, and again, talking with your provider to possibly help with, again, anxiety, depression, or whatever mental illness that you might be struggling with. First off, B vitamins. B vitamins are important for helping to build blood, and they're also important to help metabolize our food or our macronutrients and to help give us energy. So one thing that we can do is, again, take a simple B complex, and this can improve your energy and in turn can help improve your mood. Secondly, from a nutritional supplement standpoint, I like to recommend fish oil or cod liver oil. Fish oil or cod liver oil has omega-3 fatty acids in the form of EPA and DHA. These omega-3 fatty acids have been shown to increase the fluidity, if you will, of the cell membranes of our central nervous system, of our brain, and that in turn has helped to reduce our symptoms of depression and anxiety. The third supplement that I like is magnesium. If you haven't tried magnesium, I recommend trying that in the reacted form or the chelated form. It's typically a better form of magnesium that's absorbed. And magnesium helps in the production of serotonin and melatonin. It also helps to reduce the production of inflammation and stress hormones. And the fourth nutritional supplement that I would encourage you to take a look at is vitamin D. As we know, vitamin D is actually a hormone. When you're looking at vitamin D, I always encourage you to have your provider test your vitamin D level. It's important to know what that level is so that you don't get too much. Vitamin D is fat soluble, and we potentially could accumulate too much of that in our bodies. When standard medication is not offering a relief, I encourage you to talk to your provider about 2 types of compounded medication, both that we make here at the pharmacy, that might be beneficial to you. One is intranasal ketamine. Intranasal ketamine offers benefits I've seen in patients that have moderate to severe depressive symptoms. I've also seen this particular product to be very beneficial in patients that have tried traditional antidepressants and have had very little success. The other product that I would encourage you to look at is something called Dose Naltrexone. Dose Naltrexone is used for a multitude of different reasons. However, low-dose naltrexone helps to improve our body's endorphin production. Endorphins are important because they help in improving our mood, and they do multiple things in the body that help reduce pain as well. So again, intranasal ketamine and or possibly you can use these together, or low-dose naltrexone. It is important to know that we are here to help. If you have any questions, please give the pharmacy a call.